Greetings, this is Dr Sandra Cabot. The topic of this video is called gastroparesis. The term gastro means stomach, and the word paresis means partial paralysis. So gastroparesis means partial paralysis of the stomach. Gastroparesis affects about 4% of the population. In gastroparesis, the movement of the stomach muscles has become weakened or impaired. This weakness is most commonly due to damage to the nerves that supply the stomach. The vagus nerve controls the muscles and secretions of the stomach, small intestine, gallbladder and pancreas. The vagus nerve starts in the brain and travels a long way down through the chest and abdomen to supply the esophagus and stomach muscles. The vagus nerve tells the stomach muscles when and how much to contract. Anything that damages the vagus nerve can cause gastroparesis, as well as many other problems. Your stomach is the first part of the intestines to receive the food you eat and swallow. The muscles in your stomach must contract strongly to move the food along and empty the stomach. If the stomach muscles don't work properly, the food stays in the stomach and the stomach swells to a larger size. This is called delayed gastric emptying. What are the causes of gastroparesis? Diabetes is the most common cause of gastroparesis. This is because diabetes damages nerves, and in this case it is the vagus nerve that gets damaged by the high blood sugar levels. The high blood sugar levels also damage special cells called pacemaker cells in the wall of the stomach. These pacemaker cells control the rhythm of the stomach muscle contractions. Another cause can be surgery on the upper gastrointestinal tract, such as the esophagus, stomach, or small intestine, which may damage the vagus nerve. Weight loss surgery, known as bariatric surgery, such as sleeve gastrectomy or gastric bypass, can damage the vagus nerve, causing gastroparesis in a small percentage of patients. However, paradoxically, it was found by some surgeons that sleeve gastrectomy relieved gastroparesis symptoms. Another cause can be some cancer treatments, such as radiation therapy to the stomach area and some types of strong chemotherapy, which can damage the vagus nerve. Another cause can be the herpes virus, which gets into the vagus nerve, causing severe damage to that nerve. This is often not diagnosed correctly, and treatment is therefore incorrect or not given at all. Other causes of dysfunction of the vagus nerve and stomach muscles include magnesium deficiency, eating disorders, and opioid drugs. Less common causes of gastroparesis include autoimmune connective tissue diseases such as scleroderma and neurological conditions such as Parkinson's disease. In around 30% of cases, the cause of gastroparesis is unknown, and this is a good reason to try several approaches to treatment. What are the symptoms and consequences of gastroparesis? People with gastroparesis can experience many unpleasant symptoms, including feeling too full from small amounts of food, bloating, nausea, vomiting, reduced appetite, abdominal pain, burping and gas, reflux and heartburn, and regurgitation of food. This can result in weight loss and severe nutrient deficiencies. There can be an overgrowth of bacteria in the small intestine, which can lead to night sweats and aches and pains. Blood sugar levels can become more unstable, especially in diabetics, with phases of low blood sugar while food remains in the stomach, and high blood sugar when food eventually reaches the small intestines. Some people can develop intestinal obstruction caused by masses of solid, hardened food, known as bezoars. Tests for gastroparesis. It is best to see a specialist in the gut. You can choose a gastroenterologist or a surgeon who does laparoscopic surgery of the upper abdomen. Gastroparesis can be hard to diagnose and can easily be confused with other gut disorders. It is very important to get an accurate diagnosis. The specialist may order the following tests: gastric emptying scans, an upper gastrointestinal series called a barium swallow X-ray, gastroscopy, abdominal ultrasound scan, or gastric or duodenal manometry. Let's look at the treatment of gastroparesis. The treatment depends on the cause. Diabetics need to control their blood sugar levels, and in type 2 diabetes, this is best done with getting into the healthy weight range and a low carbohydrate diet. Try avoiding all grains, processed foods and sugar, and you may get a big improvement. A good supplement to stabilize blood sugar levels is called glycemic balance, and 1 capsule can be taken with every meal. Meals need to be small and more frequent, as large meals are not tolerated. It is also best not to drink fluids with meals. If you have trouble with high fibre vegetables, you can make a raw juice out of them with a juice extracting machine. Cold and hot vegetable soups and bone broth can have high nutritional value and are easy to digest. Protein requirements. Scrambled eggs can provide a complete source of protein. A smoothie made with coconut cream, whey protein powder, water, a raw egg and a fruit, such as banana, berries, mango or papaya, can boost protein intake and is easy to digest. Drink plenty of water in between meals. Keep your intake of alcohol low and avoid artificial sweeteners such as aspartame and sucralose. Artificial sweeteners can damage nerves. Magnesium supplements can make a significant improvement in symptoms. I recommend magnesium ultrapotent powder in a dose of 1 teaspoon daily in water or in a smoothie or juice. This can be taken as half a teaspoon twice daily, or if preferred, you can dissolve it in your daily water intake. This form of magnesium is easily and quickly absorbed from the gut. Magnesium is vital for strong and balanced muscle contractions, and many diabetics are low in magnesium. In many parts of the world, the soils have become depleted of magnesium. If you suspect that the herpes virus may have damaged your vagus nerve, I highly recommend you take the supplement called Selenamune to reduce damage caused by the virus. Selenium has proven antiviral effects in many studies. Damage to the vagus nerve from the herpes virus is more likely in people who have had cold sores or shingles in the past. If you suspect that your digestion of food in the stomach and small intestine is poor and making your gastroparesis symptoms worse, it is worthwhile trying digestive enzymes in the middle of your meal. Superdigestive enzymes contain a full range of pancreas enzymes along with betaine, hydrochloride, and oxbile all in one capsule. You may need 1 or 2 capsules in the middle of meals, depending on the size of your meal. Let's look at exercise and behaviours to help the solar plexus and the vagus nerve. These include Pilates or yoga and stretching. Things that stimulate the vagus nerve, such as deep breathing exercises, gargling, laughing, singing, humming, coughing and chewing gum, sugar-free, and slow deep breathing. Some gastroparesis sufferers have found it very helpful to consult a kinesiologist to balance their vagus nerve. Let's look at medications. Medications can help to alleviate symptoms and include motility drugs to increase the speed of intestinal contractions, peristalsis. These may help the stomach to empty quicker. Motility drugs include metoclopramide and domperidone. In severe cases, a drug called cisapride can be prescribed, but must be monitored for possible side effects. Antiemetics to reduce nausea and vomiting. These include medicines such as prochlorperazine, promethazine, and ondansetron. Ondansetron can be very effective to relieve nausea and vomiting and is a safe drug. Let's look at surgery. A gastric electric stimulator is an implanted device that provides controlled electrical pulses to stimulate the muscles in the stomach to speed up gastric emptying. This treatment is not always successful and is not available in all areas. Botox. Botox injections into the sphincter that connects the stomach to the small intestine can relax the sphincter muscle so that it more easily allows food passage from the stomach into the small intestine. Botox injections are not always successful and become less effective with repeated injections. Sleeve gastrectomy. Surgeons from the Centre for Metabolic and Weight Loss Surgery suspected that a laparoscopic procedure called sleeve gastrectomy, normally used for rapid weight loss, could help patients with severe gastroparesis. A study from the Cleveland Clinic showed that gastric bypass surgery is effective in morbidly obese gastroparesis patients and safer than subtotal gastrectomy. Consult a surgeon who specialises in gastric surgery if you cannot get relief with more conservative measures. Gastroparesis is a very distressing condition and can destroy your quality of life. By understanding it more and trying the measures described, you may get a big improvement. The earlier gastroparesis is diagnosed and corrected, the higher the chance of a successful outcome. Well, thanks for listening, and if you like this video, click like and subscribe. If you have any questions, email us. We love to answer your emails. Also, you can check out my free ebook called Ultimate Gut Health, which covers all gut problems from the mouth to the anus. So once again, thanks for listening.